Let's look at a range of motion testing question for the Massage and Bodywork Licensing Exam. Which finding most clearly indicates antagonist tightness rather than prime mover weakness? So we're looking at antagonist tightness rather than prime mover weakness. Remember, prime mover is the main muscle that's going to be making the movement happen, and antagonist is the opposite muscle. It's the muscle that has to relax or should be relaxing when you are doing a movement. So our options are A, limited active range of motion with normal passive range of motion. Now, if we might have limited active range of motion when an antagonist is tight and when the prime mover is weak. However, if we're going to do passive range of motion of, let's say, elbow flexion, and you have a tight antagonist, then you are going to have limited range of motion, because that tight antagonist, being triceps brachii, would be preventing the elbow from flexing. So B, pain during resisted range of motion would not be the case with antagonist tightness. Resisted range of motion would be the prime mover, an issue with the prime mover, because we're not moving the joint. C, limited active and passive range of motion in the same direction. Limited active and passive range of motion in the same direction. So I like that one the best. And then D, excessive joint play. If you had a tight antagonist, then you wouldn't have an excessive joint play. So I like C the best. Explanation: when both active and passive range of motion are limited in the same direction, this points towards soft tissue tightness or restriction, often involving antagonists or surrounding tissue, rather than weakness in the prime mover. The question wasn't asking about the joint at all, but we can pretty much eliminate joint or antagonist issues when we do resisted range of motion.